morning. It's a beautiful day. We are so glad that you are here to join us for our 2021 National Minority Health Month series. As we continue living your best life, our theme is regaining control of our lives, sponsored by the Office of University Community Partnerships and the Advocates for Healthy Living Initiative. AHLI's mission is to reduce health disparities, promote health equity, and improve the quality of life among urban seniors. We do this through our impactful programs that include a transdisciplinary education. That means that all disciplines and community are included in our work. Our targeted intervention, our base building, which means that we're making social change happen when the people who are most impacted by injustice overcome and come together to sustain and advance our collectively and our power, which encompasses collaboration and an intergenerational community-based partnership. Using an integrated intergenerational framework for our students become the change agents who are working side by side with our academic and community partners. The 2021 National Health Minority Series, Regaining Control of Our Lives, is a two-part series that furthers the AHLI mission by providing invaluable information about issues that are embedded in our minority communities. This year, our series will continue to focus on health issues relevant to our community, and it will expand into specific issues that impact men and those that love them, and the Spanish-speaking community. Before we hear from our Rutgers Newark Chancellor, Nancy Cantor, and our Rutgers School of Public Affairs and Administration Dean Charles Minifield for words of welcome, we want to express our sincere gratitude to a number of individuals and organizations that have been very supportive of our efforts of the AHLI. We want to thank our program's esteemed team of speakers and panelists for sharing their knowledge and expertise. We also want to thank the honorary chairs of this series, and we will continue to recognize them throughout this program. The New Jersey State Senator, Ronald Rice, New Jersey Assemblywoman, Cleopatra Tucker, the awesome Sarah Pena, who is the director of the State of New Jersey Center for Hispanic Policy, Research, and Development, and of course, none other than the Reverend Derek Green, who is the Senior Advisor for Diversity, Faith, Urban, and Regional Growth for the State of New Jersey, and with our Governor, Phil Murphy. We want to thank you so much for your support and commitment to this work, which embraces our seniors and respects their contributions to the world. So much of what gets accomplished with this project happens due to the collaborations among our partners who are so deeply concerned and committed and so connected and concerned about the well-being of the residents in our community and its surrounding areas. We would like to thank our fantastic academic and community partners that helped to plan the summer sessions and this series. Please note the list is quite extensive. You can view their names at the end of this program and also on our website. Two great announcements now. With support from the American Heart Association, Rutgers Center for Global Health, and Rutgers Newark Office of the Chancellor, the Sit and Fit and Zumba classes were extended and continue to remain open to the public every Friday. Moreover, many of you are aware of our new Digital Divide project, Senior Health Connect, that will provide Fire 7 tablets and direct training to our seniors. The tablets were donated by the Rotary Clubs of Newark, Roselle Park, and East Orange, Amazon, and of course, none other than Rutgers University Newark. What a wonderful partnership. And we thank these donors for their generous gift of more than 200 tablets. And a special thank you to the Rutgers Office of Technology and the OUCP team, along with our students, for serving as personal coaches to our seniors. Thank you, our AHLI Advisory Committee, a dedicated group of caring individuals who put seniors in the forefront of their work. And today, now, I would like to introduce you to and to have you to hear greetings from a chancellor that is committed to community and recognizes the importance of community partnerships in advancing our institutional anchor mission. I present to you our Chancellor, Nancy Cantor, who will be followed by Dean Charles Minifield. Chancellor, again, we thank you for all of your support.
As you may know, this initiative launched last summer when we were still in the first wave of the coronavirus. A very broad coalition of Newark's community and faith-based organizations, as well as local health professionals, came together with the amazing Dr. Diane Hill and the team at the Rutgers Newark Office of University Community Partnerships, because we were all seeing that even for those who did not get the virus, our physical and mental health and well-being were threatened because of our isolation from each other. That threat has been real for people across the country and around the world, but it has been especially intense in communities like ours in Newark, where the pandemic made already deep and broad health disparities even more evident and more intense. So our Advocates for Healthy Living initiative put together a 5-week series of virtual health and wellness events called Living Your Best Life Virtually, that featured everything from exercise classes and tutorials on healthy food selection, gardening, and cooking, to lectures by renowned physicians, researchers, scholars, and healthcare and aging services experts, guided meditation, and musical entertainment. It was so well received that with support from the American Heart Association and the Rutgers Center for Global Health, we were able to continue the exercise classes through the winter. And from the messages that I've received, this has been a big success. With spring here again, even as we are in the midst of an upsurge in COVID cases in New Jersey, we can still hope that the finish line is not far ahead. But as we also keep hearing from health leaders, now is not the time to let up. So this new National Minority Health Month program from AHLI is just what we need to begin to regain control of our lives and finish the race. We could not be more grateful to the range of HLI partners and advisory board who've been helping put together this fabulous 2-part workshop, where you'll hear from esteemed panels of medical professionals, community leaders, and students, with a special emphasis today on men's health and next time on the Spanish-speaking community. Enormous thanks to our wonderful team and enormous thanks to you for joining us. Stay safe and stay healthy so we can all cross that finish line together.
Good morning and welcome to the 2021 National Minority Health Month series, Regaining Control of Our Lives. As a Black man, I am pleased that this year's series devotes an entire morning to the health disparities that continue to plague men of color. The statistics are bleak. According to data shared by the Centers for Disease Control and Prevention, the National Cancer Institute, and the U.S. Department of Health and Human Services, Black men live 7 years less than men of other racial groups. Black men have higher death rates than Black women for all leading causes of death. 44% of Black men are considered overweight and 37.5% are considered obese. Black men tend to suffer more preventable and treatable oral diseases. They have a higher incidence of diabetes, prostate cancer, and oral cancer. Black men also have a much higher rate of developing HIV/AIDS in comparison to others. With respect to Hispanic men, we have learned that 44.8% are obese, 46% are hypertensive. Last, heart disease, cancer, and unintentional injuries are the leading cause of death among Hispanic men. Now, there are a host of reasons why these health disparities exist. Many are steeped in economic and social conditions that persist among Black and Hispanics to a greater extent than whites. For example, many Black and Hispanic adults do not have health insurance. Consequently, preventable health care, like a regularly scheduled wellness visit to a primary health care provider, becomes a costly endeavor. Other explanations for health discrepancies could be the high rates of incarceration, unemployment, poor health education, and insufficient medical and social services that cater to Black and Hispanic men. However, there's good news. The Advocates for a Healthy Living Initiative is aware of these disparities, and they aspire to empower our communities of colors, especially our senior citizens, to be more proactive about their health and well-being. The 2021 National Minority Health Month series, Regaining Control of Our Lives, is a perfect example of the meaningful and impactful programming offered by the Advocates for Healthy Living Initiative. We thank Dr. Hill and her hardworking team at Rutgers University, Newark, Office of University Community Partnership for assembling such esteemed speakers for this series. We want to thank the honorary chairs of the series, New Jersey State Senator Ron Rice, New Jersey Assemblywoman Cleopatra Tucker, Sarah Pena, Director of the State of New Jersey Center for Hispanic Policy, Research and Development, and Reverend Derek Green, Senior Advisor for Diversity, Faith, Urban and Regional Growth for New Jersey Governor Phil Murphy. We applaud each of you for logging on today to learn how you can be a catalyst for change in your personal lives and that in the community. This series promises to be insightful and engaging. Please enjoy.
Hi, my name is Dr. Alexander Salerno, and I'm an internal medicine doctor in East Orange and Newark, New Jersey. I'm also the founder of UHIP, a non-for-profit organization that focuses on healthcare literacy and education, basically facts over fiction, so we can improve and close gaps when it comes to healthcare and healthcare outcomes. So today, I just want to take a brief moment just to talk about the importance of preventative medicine, proactive medicine, versus reactive medicine. And the philosophy of it ain't broke, don't fix it is a broken philosophy, especially when it comes to our health and as we age. So when I try to approach the human body in a way that we can relate to, I like to say that the human body is no different than a car. And we know men are very good about taking care of their cars and checking the fluids and servicing their cars and rotating the tires and making sure they get a lot of longevity out of their car. So the car analogy is very much similar and in tune to the body analogy. When you look at the brain, for instance, the brain is basically the computer chip in the car, and that runs all the systems and makes sure everything is running smoothly. The eyes are the headlights. So, you won't drive a car without functioning headlights, and you need your eyes to be able to function properly and see properly, because glaucoma, cataracts, and macular degeneration, these are normal, typical aging issues of the eye. If detected early, will not affect our headlights. The lungs are the radiator. So the radiator keeps the engine cool and the system cool. The lungs exchange air and keep the body functioning. The heart is the engine, clearly. And so you could have a 12-cylinder engine or you could have a 4-cylinder engine. Heart disease determines that. Congestive heart failure determines that. Heart disease is the #1 cause of death in our country and in the world. And congestive heart failure is the #1 still to date leading cause of hospital admissions and emergency room admissions. So the heart is the engine, and you want it to be a 12-cylinder engine. And engines have check engine lights, and we know 5,000, 7,500, 10,000 mile services. Your heart needs a healthy heart checkup once a year. That's why February in America is National Heart Disease Awareness Month. Next, your colon. Your colon's the exhaust. And colon cancer is the second leading cancer that men get. It's important because just like we get gray hair and wrinkles outside showing our age, colons, when they turn 50 years old, start to get polyps. In fact, 1 out of 3 men between the ages of 50 and 70 will have a polyp. Polyps always start out innocent, but they can turn to cancer because they grow, just like weeds grow in your backyard or mushrooms grow in a forest. Size matters. 2 centimeters is the size that matters when it comes to the colon, which is the exhaust. Then you got basically your legs, knees, feet. Those are the tires and the suspension of the car. And so it's important, especially if you're a diabetic, to make sure your tires are good because of the association of diabetes and amputation and diabetes and nerve damage. But another population that develops also issues with amputation are smokers. We know smoking is one of the leading causes of peripheral artery disease. So you want to really make sure your suspension, your tires, your air pressure is good, the tire tread is good. Otherwise, you're going to be affecting the overall ride and performance of your body. Again, cars come with instruction manuals. Cars come with warning lights. Bodies come with instruction manuals, and that's called the U.S. Task Force in Preventative Medicine. These are guidelines because medicine is science. Science is facts. Doesn't matter your zip code or area code, you got to follow the science. And our focus is always first on prevention, because my dad used to say, and my dad was a doctor for 59 years in East Orange, a pound of prevention is better than a ton of treatment. So again, that ain't broke, don't fix it mentality is broke, real broke. And oftentimes things like hypertension go 10 years undiagnosed, untreated in the African American male before we pick it up. And a lot of men make decisions based on fiction and not facts. So you got to get the facts. You test out cars, you go to consumer reviews before you buy a car, you ask around about cars in dealerships. You should do the same regarding your health, your body, and your doctor. So, be an informed consumer and know your health and know what you need to be aware of before you go into your visit. But remember, you got to do your checkups, because the checkups follow guidelines and lead to prevention and early detection. The other thing I want to talk about just real quick and briefly are the importance of vaccines, especially now more than ever. Even before COVID came to our country a year ago, pneumonia and flu were and are the 8th leading cause of death and hospitalizations in the United States. That's the importance of the flu and the pneumonia vaccine. People think vaccines make you sick. People think vaccines are experimental medicine. Again, fiction, not facts. The idea of the COVID vaccine, it's not experimental medicine. It's proven medicine. The technology behind Pfizer and Moderna has been around for over 11 years. That technology has been used in the treatment of cancer. That technology has been used in the treatment of Ebola virus, Zika virus. It's a proven science. We did not cut corners. We are not doing experimental medicine. We are fighting the most infectious virus this country has seen, and you see it because you hear about it because people around us are getting it and dying from it. And right now, we're dealing with the new strains of the British, Brazilian, and South African strains that are even 3 times more infectious than the Chinese strain that came over a year ago, which makes it even more dangerous. And more important than ever in this race to get back our freedom is to get the vaccine to protect yourself, protect your family, and protect your neighbor. So vaccines are important. When you were little, you got vaccines not to get chicken pox, not to get measles, not to get mumps. Well, when we get older, we should get vaccines not to get flu, not to get walking pneumonia, not to get shingles, and certainly not to get COVID. So it's important that you know the facts, and it's important that you get these very safe vaccines. I got the COVID vaccine. I'm 53 years old. It was the first adult over the age of 50 vaccine I took, and I didn't even think twice about it. I took my mom, who's also a retired physician, 88 years old, for her 2 vaccines. And that too was one of the first vaccines she's taken in well over 10 years. She didn't think about it either. So it's important. There's more and more opportunities now to get this vaccine. NJIT is opening up a mega center. More and more churches and congregations are getting the vaccines. Get the vaccine, because that's the only way we can resume normalcy and get our freedom and get our just back to normal way in our communities. So that's important. And again, the pneumonia and flu vaccines. It's also important to know that when you do get a vaccine, it is normal to get reactions like body aches, headaches, even a low-grade fever. Why is that normal? Because that means your immune system has recognized the virus and created a response to the virus, like the body aches and the headache, which I got after my vaccine. It only lasted a day. I took Motrin and drank plenty of fluids, and I felt fine. And I now have antibodies because I tested myself, and I see that I now have a working vaccine in my body protecting me from the Chinese strain and most likely as well these British, Brazilian, and South African strains. So please, get the vaccine, get the facts, and pass it forward to your neighbor and to your friend and to your relatives to really be getting the word out and getting the message out. So again, my focus here is always on prevention as a primary care doctor. My focus is on facts over fiction. My focus is on knowledge is power, and you need to know your body, and you need to know what we need to focus on your body, and that, it ain't broke, don't fix it is a completely broken, outdated philosophy. It's like watching a movie on a black and white TV. None of you have black and white TVs, I'm sure. So why would you treat your body, your health, and your future through a black and white TV? So again, get the facts, have a communication, and like I say, when we were kids, we had report cards. We all now have report cards as adults, but we call them healthcare report cards to prevent against cancer, heart disease, and get the vaccines, which are really important, so you can stay well, healthy, and not in a diaper, in a nursing home, not being able to tend for yourself, which is unfortunately what I have seen way too soon, way too often, and it doesn't need to be that way. So I give thanks for this opportunity to reach out to you and speak to you. I look forward to working with the community as we continue to do. And if anyone has any questions, UHIP is our organization, Urban Healthcare Initiative Program. It's been around for about 8 years, and our focus is on creating relationships and paving the way to better healthcare outcomes, because we need to do that, and now more than ever. Thank you very much.
I came in for a routine examination, which I usually do because I have a good relationship with my doctors. And about a week later, they told me that they saw some tumors in my prostate that was considered cancerous. And I went on the internet and Googled robotic surgery, and I tried to find who was really, really good at it. And I ended up finding my doctor here, which was Dr. Isaac Kim. I stayed very close to my brother, who actually, I will say, saved my life, because unfortunately he discovered his cancer a little bit too late. It took him. He was actually a very gifted and notable musician, and I started Jazz for Prostate Cancer Awareness in honor of my brother, who was a jazz trombonist.
No detail, no explanation. You have prostate cancer.
I wasn't really thinking that I was ever going to have cancer.
That's when it sets in. What's this going to do to my life, my lifestyle, my pocket, and my people?
There's a lot playing against us because of the environment, the toxins, and the food that we eat, which we fall right into because the thing like I say, the Food and Drug Administration, why are they together?
We live in a time, I think, where cancer is now a little bit like the flu. You know, like when I was a kid, everybody got the flu. They didn't get cancer. Now it seems like everybody's getting cancer like they get the flu.
That was devastating to find out that one by one, my brothers had prostate cancer. No symptoms, just go to the doctor, I have cancer.
Somewhere along the line, men have to start discussing this between themselves. Men don't talk a lot about personal stuff like that. And it has to be socialized. This is really important.
I mean, we're literally talking life or death.
And that's one of the things that Jazz for Prostate Cancer Awareness helps do. It puts it out there, it starts the conversation, and it uses jazz as the easy medium to broach the topic.
To recognize that just going to the doctor for regular physicals and checkups is not enough. You got to get cancer screenings that are age appropriate, condition appropriate, whatever your physical condition is.
I came up here because I think it's important that we get this screening done. There's too many people. Donna Blackman died too young.
Yes.
Prince died too young.
Yes.
This is all medical related.
So, we're here with
Onaje Allen Gums, keyboardist. I remember hearing Randy Weston, who is an elder and a master. He's 90 years old. He said music is for healing. You see.
The guitarist is there. When they all play together, it creates a full spectrum of frequency. That's how come the body responds to it. That's why the body wants to dance.
We gonna do it for James though. Yeah. We gonna rock to the same flow. 1, 2, 3. Sometimes you in the right place at the right time. It's something so sublime when the stars align. The pleasure is always mine. The level we ought to climb to is right within our grasp. Lord, show me a sign. I'm awake, I'm arise, I'ma ask, who am I? As the rhythm amplifies to the beat. We gon' do it for James so. Yeah. We gon' rock to the same flow. 1, 2, 3. Sometimes you in the right place at the right time. It's something so sublime when the stars align. The pleasure is always mine. The level we ought to climb to is right within our grasp. Lord, show me a sign. I'm awake, I'm arise, I'ma ask, who am I? As the rhythm amplifies to the beat of my soul. See the glow in our eyes, mind open and wide. God gave us the drive and now we in control. We rock to the same flow. We do it for James Stowe. We do it to take you places that you thought you can't go. We never gon' aim low till awareness is high. Just a little bit of knowledge could help us survive. Know yourself, know your numbers, man, we need to be wise. If we lift one another, we could easily fly. Who gon' keep me alive? Well, it seems to be I. This a PSA, check your PSA and Drake. I'm in the right place at the right time. So sublime when the stars align. The pleasure is always mine. The level we ought to climb to is right within our grasp. Check your PSA and Drake. I'm awake, I'ma rise, I'ma ask, who am I? As the rhythm amplifies to the beat of my soul. See the glow in the eyes, mind open and wide. God gave us the drive. We rock to the same flow. We do it for James Stowe. We do it to take you places that you thought you can't go. We never gon' aim low till awareness is high. Just a little bit of knowledge could help us survive. Know yourself, know your numbers, man, we need to be wise. If we lift one another, we could easily fly. Who gon' keep me alive? Well, it seems to be I. This a PSA, check your PSA and Drake. Hey, check your PSA and Drake. Hey, hey, check your PSA and Drake.
around like a circle in a spiral, like a wheel within a wheel, a never ending or beginning, like a never spinning reel, like a snowball down a mountain or a carnival balloon, like a carousel that's turning, burning rings around the moon, like a clock whose hands are sweeping past the minutes of its face, and the world is like an apple swirling silently in space, like the circles that you find in the windmills of your mind. Like a tunnel that you follow to a tunnel of its own, down a hollow to a cavern where the sun has never shone, like a door that keeps revolving in some half-forgotten dream, like the ripples from a pebble someone tossed into a stream, like a clock whose hands are sweeping past the minutes of its face, and the world is like an apple swirling silently in space, like the circles that you find in the windmills of your mind. Is that jingle in your pocket or the jangle in your head? Why did summer leave so quickly? Was it something that I said? Lovers walk along the shore and leave their footprints in the sand at the sound of distant drumming or the fingers of your hand. Pictures hanging in the hallway, in the fragments of this song, half-remembered names and faces, but to whom do they belong? When you knew that it was over, were you suddenly aware that the autumn leaves were turning to the colors of her hair? Like a circle in a spiral, like a wheel within a wheel, never ending or beginning, like an ever-spinning reel, as the images unwind, like the circles that you find in the windmills of your mind. Pictures hanging in the hallways of the fragments of this song, half-remembered names and faces, but to whom do they belong? When you knew that it was over, were you suddenly aware that the autumn leaves were turning to the colors of her hair? Like a circle in a spiral, like a wheel within a wheel, never ending or beginning, like an ever-spinning reel, as the images unwind, like the circles that you find in the windmills of your mind. In the windmills of your mind. The windmills of your mind. Windmills of your mind. Of your mind, your mind.
Weren't today's speakers phenomenal? Because of their expertise, we will all depart this program more enlightened and enriched. We hope to see you in 2 weeks from now, April 30th. Don't forget, for our final session. It will be conducted entirely in Spanish. In the meantime, please visit our website to learn more about the AHLI and our upcoming events. And we invite you to register for our Sit and Fit and Zumba class. Please remember to invite a friend. Again, thank you and have a healthy and safe weekend. Thanks for joining us again.